Your legs hurt, your arms hurt, your hands hurt.
She started to repeat herself.
I just wasn't feeling well, and I felt that I had no purpose.
The doctor said to me, there's nothing else I can do.
I have no energy.
I can't focus.
So weak. Couldn't move anymore.
Steps are impossible.
I can't remember anything.
I felt like a ticking time bomb.
We're in an epidemic of chronic disease that's unlike anything ever before in human history. It's costing $47 trillion over the next 20 years and is bankrupting our country. We need to solve this, and we need to solve it now. And functional medicine is the solution that's going to drive the change. Conventional medicine, we name the disease based on symptoms, and then we tame it with a drug. The problem with chronic disease is that it's not cured by a single pill. We need to think differently. We need to think about the body as a dynamic system. Everything's connected. We need to think about the root causes. And then by treating those underlying root causes, understanding the mechanisms, we can solve this problem of chronic disease.
One night, I was walking in the grocery store. All of a sudden, my legs felt like lead, and I couldn't walk. I have scleroderma and lupus, CNS lupus. They gave me intravenous prednisone and chemo. I was really feeling pretty awful. A cousin said, "Jean, I want you to go see my functional medicine doctor." And that's the first time I've ever heard the term functional medicine.
In Jean's case, we restored balance to the gut, we replaced nutritional deficiencies, and we encouraged lifestyle modification.
Through functional medicine and the change in the diet, I'm not a diabetic anymore. I've never had an issue with my legs again. Within the first 8 months, I felt like, oh my gosh, I'm getting my life back.
84% of the $3.8 trillion in healthcare costs are driven by chronic disease, and it's actually preventable or even treatable with a new model of medicine.
My mom would ask the same question 3 times within 5 minutes. And I realized that something was wrong. It was extremely low in B12. She had an underactive thyroid. She had an allergic reaction to gluten and dairy. Within 30 days, she had her memory back and the mind that she had 10, 15 years earlier. It was extraordinary.
Our understanding of disease is transforming because of emerging science of genomics, because our understanding of the mechanisms of disease. We also know that the gut microbiome is now linking so many conditions.
I was diagnosed with Crohn's my senior year in high school. I felt pretty ill all the time, fatigue, pain. I probably have been on 12 different medications. Nothing worked. I saw Dr. Bergman. He looked at things that no one had ever checked before. They found these latent hidden infections. They found some hormone issues. His idea was, how can we make sure all the systems in your body are working the way that they're supposed to?
We look for biochemical abnormalities, nutritional deficiencies, viral patterns present in the body, immune system dysfunction, GI tract or gut dysbiosis. When we identify these issues, then we treat them both with traditional medicine and we treat them with diet and lifestyle modification.
Within 4 weeks, I started to see results from the changes that we were making in diet and in supplements in terms of decrease in pain and decrease in diarrhea and other symptoms like that. I was surprised that it was that quick.
I went to see my neurologist back in my hometown. He said, "Your lesions in your brain have shrunk. They're barely there anymore." He said, "I've had other patients on this protocol and none of them have had this kind of result." I said, "I haven't had any sugar, dairy, gluten in 8 months." And he said, "There's no research, Jean. There's nothing here that tells me that that's the case." And I said, "Just me. Who's had the best results out of any of your patients?"
We're looking at randomized trials across a number of different diseases to show that we can have better outcomes compared to conventional care.
We have the urology protocol in collaboration with functional medicine in terms of approaching patients with prostate cancer. We want to see if we can slow down the behavior of the prostate cancer cells by changing the diet and the supplements that we're giving the men.
Given the tsunami of chronic disease, Given the overwhelming economic burden, the social burden in terms of our happiness, we need to change the way we do medicine.
And I think one of the main components of that is going back to the biochemistry of what's going on in the body.
If you can identify the malfunction, then you can open up that pathway and support it. And applying that clinically with my patients has been profound in their outcomes. It's been amazing.
It's an amazing thing that after 16 years of dealing with this disease, I can see that my body's starting to work in the way that it should.
I am absolutely convinced that this is the future.
Functional medicine has changed my life completely. I'm healthy and alive again.